Hello, dear friends. Welcome in this live session about organ. Last time we discussed about the physician, and today we are going to discuss about homeopathic physician. Everything will be from organ of medicine, what Hahnemann said to us. So we know that every physician having missions, they have any sole aims. We discuss about what not do by any physician and the qualifications of the physician. So, sole aim of the physician. We have to take the case as it is mentioned in aphorism number 84 to 105. Second thing, during case taking, which one we have to consider its importance as compared to the other things. If we see organ of medicines, so the sole aim, what is the sole aim of the physician? So if we go to aphorism number 153, what Hahnemann said, he said, in this search for a homeopathic specific remedy, that is to say, in this comparison of collective symptoms of the natural disease with the list of symptoms of known medicines. One side there is a natural disease, other side we have a symptoms of medicines. So what we have to do, we have to compare natural disease symptoms and medicinal symptoms. And in order to find among these an artificial morbific agent corresponding by similarities to the disease to be cured. So, after comparing disease symptom with the medicinal symptom, we have to find out any particular artificial morbific agent which help us to eradicate the disease from the sick. What we need, what type of symptom we need to focus on. So these are the more striking, singular, uncommon, peculiar sign and symptoms. These are the few things we have to focus on while case taking. So, the more striking, singular, uncommon, peculiar characteristic symptoms, sign and symptoms of the case are chiefly and most solely to be keep in view. While case taking, aphorism number 83 to 105, during this process, we ask questions. We we consider every symptoms and find out what type of symptoms are very different, which shock you. And these are peculiar striking symptoms, more striking, uncommon symptoms. As mentioned, I last time I mentioned one case, small kid case, one where the person having a stool into the small large intestine collected and he is not able to pass that stool. What are the characteristic of that case? The patient is constipated, the large amount of stool collected into the large intestine. What are the characteristics? Whenever he eat, after a few minutes, he has abdominal pain, he vomit out, come back, start eating again. If we see characteristic, the Allen's keynote, if you open Ferrum metallicum. This is the very clear-cut case where Dr. Hahnemann Dr. Allen says vomiting immediately after midnight or ingesta, whatever he eat, immediately he is vomit out as soon as the food is taken. The the patient having whenever he eat immediately after eating during eating he has a pain in the abdomen, he has to vomit out, leaves table suddenly, and with the one effort vomits everything eaten and can sit down and eat again. Practically, this is different because this is one of the peculiar symptoms, especially in case of constipation. If you go for the constipation and try the specific remedy for constipation like bryonia or like opium, it will not work because concomitant symptoms are much more important during these cases, and these symptoms should be very peculiar, which when you see you shocked, fully shocked. So every case we need peculiar characteristic symptom. I give you one more example. I put one case, this case on my timeline. So the lady having a corn in the foot, and that corn was for long time there, almost 1 year. But at that time, that corn was not painful. So that corn is not disturbing her. But suddenly it start paining. When it start paining, she is running here and there to get rid of this pain. Doctor, I have this corn from last 1 year, but now it's paining. It will more increase. The pain will more increase. I need the medicine. Before she was totally indifferent from the sickness that corn because that pain was not painful. But now it's painful, and she is fearing that it will increase. It will more disturbing her. So fear of extra vengeance. This is the particular peculiar fear, and that fear is the uncommon characteristic symptom of opium. Here opium is the remedy, and opium cure the corn, and mostly people cannot think about opium in corn, and that case was cured in 48 hours. So for it more particularly, these that very similar one in the list of symptom of the selected medicine must correspond to. The symptoms, the striking symptoms are very close to any particular remedy in order to constitute it the more suitable for affecting the cure. The more general and undefined symptom. Next, one side we get the more peculiar characteristic symptom, and other side which are very morely most general and undefined symptom like loss of appetite, headache, debility, restless sleep, discomfort, so forth, demand but little attention when of that vague and indefinite character. When they are simple, they are not characteristic. For example, one person having a stool, he said, Doctor, whenever I go for stool, first the liquidy part of stool come, and after that the solid one. Very peculiar stool. Mostly this is not happening in anyone. It's hard stool, after that slowly the soft stool or one characteristic stool. But In Naxuamica, the patient having a liquidy or soft stool first and after a hard stool. Very peculiar to Naxuamica. Until and unless these general symptoms are indefined, we cannot get we have to give little attention to these symptoms. If they cannot be more accurately described, a symptom of such a general nature are observed in almost every disease and from almost every drug. So, this is a homeopathic physician's sole aim to find out characteristic, peculiar, uncommon, singular symptoms, characteristic symptoms. This is our sole aim. Second thing, qualification. What are our qualification? As in last video, I mentioned the qualification of the physician, aphorism number 3, knowledge of the physician. One side is knowledge of the physician, second is qualification. What are qualification? If we see aphorism number 81. So careful investigate a patient, note his symptom and characteristic and never guesses hypothetically. If you see aphorism number 81, the last two paragraph of footnote, from all this, it is clear that these useless and misused so second thing, from all this, it is clear that these useless and misused name of diseases ought to have no influence on the practice of true physician. If you are a true physician, name of the disease will not disturb you because we have to find out peculiarity of that cases. Who know that he has to judge of and to cure diseases, not according to the similarity of the name of a single one of their symptoms, but according to the totality of signs of the individual state of each particular patient whose affection it is his duty carefully to investigate but never to give hypothetical guesses to it. Hypothetical, high hypothetical. One person comes to you and having a malaria, he show you a report, and he after seeing the reports, and so many doctors are mentioning how I have this remedy, I have this diseases, you can use this remedy for this type of diseases. Never, we are not prescribing on name. We have peculiar symptoms, we are finding out the peculiarity of the case. If we are giving you and mentioning that this remedy is for this disease, it means we are hypothetically mentioning without considering the sign and symptom of the disease. If person having a malaria, these person having a peculiar symptoms which differ that person from other person. And homeopathy is not proved according to the diseases. These remedy proved and collected as a symptoms. Every remedy having a different symptoms during even in proving. No, we have never to give a hypothetical guesses to is it. And if when we are mentioning the diseases, mostly we are not considering these diseases. If anything, simple fever to cancer, if symptoms, only symptom guide us to collecting or selecting the remedy. Next, what Hahnemann says, if, however, it is deemed necessary sometimes to make use of name of disease. Sometimes we mentioning the name of disease in order when talking about a patient in an ordinary person. One person having a condition and few relatives come to you and talk to you and says what kind of problem he has, then we are mentioning that this kind of problem this person has. And to render ourselves intelligible in a few words, we ought only to employ them as a collective names and tell them this patient has a kind of sandwiches dance, this kind of dropsy, a kind of typhus, a kind of malaria fever, or but in order to do always once for all with the mistaken notions these names give rise to, and we should never say it has the St. Vitus dance, typhus, dropsy, malaria, as there are certainty no diseases of these and similar name of fixed unvarying characters. No. So very similar to malaria, very similar to typhoid like symptoms. This is typhoid like symptoms. We are not going anything hypothetically. We are not saying anything hypothetically. We are not mentioning our remedy according to the disease name. And if anybody is doing this, he is not homeopath. He is not following the rules of homeopathy. This is against the rule of homeopathy. Next, observer. The physician should be an observer. Observer. Each physician can train himself to be a good observer. Now, if you go aphorism number 141, this is very important, and I will read everything, every single verse for you guys so you can understand what Hahnemann wants to say and how one homeopathic physician is consider himself a true physician. So the best proving of a pure effects of simple medicine in altering the human health and of the artificial disease and symptom they are capable of developing in healthy individual are those which the healthy, unprejudiced and sensitive physician institute on himself with all the cautions and care has enjoined. What happened with this? He knows that the greatest certainty, the thing he has experienced in his own person. there is no doubt remaining behind it. If sometimes if the prover are 5, 6, 7, and we are always in doubt that that person give us a proper explanation of any symptoms or not. So here in footnote, those trial made by physician on himself have for him other and inestimable advantage. He has a advantage of it. What kind of advantage? He write again. In the first place, the great truth that the medicinal virtue of all drugs, whereon depends their curative powers, lie in the changes of the health we has himself undergo from the medicines he has proved and morbid state he has himself experienced from them, because becomes for him an incontrovertible fact. So there is no contradiction. For example, sometimes we we said that we cannot remember all the sign and symptom of the proving. If somebody is doing proving, if something happened with you, even after the 4, 5, 10, 50 year after, we always remember that thing. It is always remember in our brain. So when we are doing proving, we feel the changes, and what we feel even in our childhood, we still remember many things. If that disturbing thing, that changes affect you internally, it never be a forgettable. So during proving, we always remember what changes happen in us. If anyone becomes sick in childhood, if you ask him after 50 years, he will tell you, I was sick when I was small kid. He will remember everything. So there is no contradiction. Again, by such noteworthy observation on himself, when he is doing observation on himself, he feel that I feel this, I feel that, my pulse is increasing, my heartbeat is increasing, I have a difficulty in respiration, I have a sensation like my tongue is something, some like is very dry, but there is a dryness, but I don't like to drink water. I don't want to drink water or anything else. Again, by such unworthy observation on himself, he will be brought to understand his own sensation. Observation. He observe himself and he can understand the sensations, his mode of thinking and his disposition. One, sensations. Second, his mode of thinking. Third, his disposition. The foundation of all true wisdom. This is the foundation. And he will be also trained to be what every physician ought to be. And he understand what kind of knowledge, what kind of keen observation every physician's needed. A good observer. He observed that all our observation on others are not nearly so interesting as those made on ourselves. If somebody is feeling inside, we always in a doubt, he's truly feeling this kind of stuff inside or not. If we are feeling anything, we are feeling like that I have divided into two parts. My body is like very light. I'm floating in the air. These sensations make us more clear, more peculiar. The observer of other always must always breed at least the experimenter did not feel exactly what he said. As I mentioned, or Dr. Hahnemann mentioned, whenever other one is proving, and we always in doubt that that person is really feel like this or not. Or least he did not describe his sensation with the most appropriate expression. Sometimes the expression is inside is different, but the words what he used during expression is different. This is also a big problem. He must always remain in doubt whether he has not been deceived, and at least to some extent. These obstacles to the knowledge of the truth, these are the obstacles. These are the hindrance to getting the purity of the symptoms, which can never be thoroughly surmounted in our investigation of the artificial morbid symptom that occur in other from the ingestion of the medicine sees entirely when we make the trial or on ourselves. When somebody is trialing, we all always in doubt. But when we are uh, uh, when we are proving, then there is no doubt because we feel what we are writing, what we feel inside. He who make these trial on himself known for certain what he has felt, and each trial is a new inducement for him to investigate the power of other medicines, and he thus become more and more practiced in the art of observing of such importance of the physician by continuing to observe himself, the one on whom he can most rely and who will never deceive him. He will never deceive. You cannot deceive yourself. When we are proving medicine, we feel the sensation. We know that's what is happening inside, and we cannot deceive ourselves. What we feel, that the same thing we will write. And he will do all more zealously as these experiment on himself promise to give him a reliable knowledge of the true value and significance of the instrument of cure that are still to a great degree known to our art. This is the great degree unknown to our heart. So proving observer, if somebody is doing, proving on himself or herself, this proving make that physician more accurate observer, more unprejudiced observer, unprejudiced observer. Next, he observed, he observed increased aggravation of symptom with when suppressed palliatively. If somebody, so this is aphorism number 58. If you read aphorism number 58, Dr. Hahnemann says, if in estimating the value of this mode of employing medicine, we should even pass over the circumstances that it is an extremely faulty symptomatic treatment, wherein the practitioner devotes his attentions in merely one sided manner or to a single symptom, consequently to only a small part of the whole, whereby relief for the totality of the disease, which is what the patient desire, cannot evidently be expected. When we are focusing on one side, when we are focusing on single symptom, when we are giving more importance to a single symptoms, it will give you a momentum relief, but you cannot expect any cure from it. It is not a whole disease. It is was just a single symptom. For example, I just mentioned the case of the corn on in the feet. That is very simple, one-sided problem. But when after it is paining, what then the person showing that what is inside, what is happening inside. So during this process, during this condition, we have to collect totality. The, Dr. Hahnemann mentions ahead, we must, on the other hand, demand of experience. If in one single case where such antipathic employment of medicine was made use of in a chronic or persisting affections, after the transit amelioration, there did not ensure an increased aggravation of the symptom which was subdued at first in a palliative manner, and aggravation indeed of the whole disease. Sometimes patient get the remedies and after getting the symptoms are removed, but soon these symptoms again comes in a more aggravating form. And it happens every times whenever we are suppressing the condition. Many times I saw sometimes patient having a nasal droppage and the doctor give you a nasal spray, and after using or the using the asthmatic pump. So during this process, when we are taking it again and again, and mostly citrazine is the medicine they are giving for anti-allergic. When we are using these remedies continuously, then after a short times you are addicted to it, and after that these medicine are not working on you. So then we find out something else which give relief. They are increasing the dose, and after a limit they are stop working. So every attentive observer will agree that after such short antipathic amelioration, everyone aggravation follows in every case without exception. And we have, as an attentive physician, we have to observe all these aggravations. When you leave the medicine, anybody who is taking the allopathic or any medicine, after leaving, what kind of symptoms comes out? This is our duty to observe these symptoms. Although the ordinary physician is in habit to giving his patient another explanation of this subsequent aggravation and ascribe it to malignancy of the original disease, now for the first time showing itself, or to the occurrence of the quite a new disease. And what Hahnemann mentioned here, he says, little as physicians have hitherto been in the habit of observing accurately. This is our drawback. Very few, very few physicians having a habit to observe the patient. Very few. Little, even 250 years before, Dr. Hahnemann says very little physician, little as physician have Atito been in the habit of observing accurately the aggravations that so certain follow such palliative treatment could not altogether escape their notice. Very few. And we are, whenever we are get the patient, we are ready to take this symptom, that symptom, or give 4 or 5 medicines. I have seen many times. That's why organon is much more important here. Observe the patient. What kind of symptoms produce after he taking that palliative treatment? Is it before the treatment, or it is now it produces after the taking medicines? One person who doesn't have any problem and he has a history of hypertension in his family, after after 40 he start taking medicine for cholesterol because he has a high cholesterol level, and doctors give them many type of medicines, and after taking these medicine from 10-15 years, now this patient having a bleeding from the throat, and he's taking first he taking small dose, and now he is taking very large dose, but still he is taking. It means these symptoms, these medicines having a side effects, many side effects, which now showing in the body. Next is master in observations of distinguished symptoms of the simple medicine employed on the curative purpose for the symptoms of the disease, especially in chronic cases in case of clinical proving. Aphorism number 142. In 141, Dr. Hahnemann mentioned that we have to do trial or ourselves. When we are doing trial, our observating power increase. We are more attentive. And aphorism number 142, but how some symptoms of the simple medicine employed for a curative purpose can be distinguished among the symptom of the original malady, even in disease, especially in those of the chronic character that usually remain unaltered, is a subject appertaining to the higher art of judgment and must be left exclusively to the master in observations. And if you read the footnote, symptoms which during the whole course of the disease might have been observed only a long time previously or never before, consequently, new one belongs to the medicines. The symptoms which are before so many years or after taking the medicine, now they are producing, it means these are producing by medicines. Produced by medicines. So that's why Dr. Hahnemann mentioned every time. That's why this book is needed. So next is, these is observations. Aphorism number 141, footnote 58 and 142. Next, what one homeopathic doctor more need to understand? Note the most significant factors in the history of protracted wasting sickness to find out the fundamental cause. And where we find the fundamental cause? Aphorism number 5. Useful to the physician in assisting him to cure are the particular of the most probable exciting cause of the acute, and also the most significant point in the whole history of the chronic disease, to enable him to discover its fundamental causes, which is generally due to the chronic miasm. And in this investigation, what type of thing we have to take extra care? The ascertainable physical constitution of the patient, especially when the disease is chronic, his moral and intellectual character, his occupation, mode of living and habit, his social and domestic relations, his age, sexual function, etc., are to be taken into considerations while taking the case when the disease is chronic by nature. Chronic by nature. Next is, prudent physician must be able to judge where to apply the medicine, where not. Aphorism number 76. If you read aphorism number 76, only for natural diseases has been benefited dightly granted us in homeopathy the means of afford relief, but those devastations and maiming of the human organism, exteriorly or internally affected by ear frequently of the unspring exercise of false art, with its hurtful drugs and treatment, must be remedied by the vital force itself, appropriate at being given for the eradications of any chronic miasm that may happen to be lurking in the background. We have to find out that where we need to give medicine or where we have not to give medicines. Next is aphorism 150. If the patient complained of one or more trivial symptoms that have been only observed a short time previously, the physician should not regard this as a fully developed disease. Person who having a few symptoms like he has a palpitation or he has a acidity or something, he did eat something wrong, every physician not give the medicine for that simple same time. Physician should not regard this as a fully developed disease. This requires serious medical aid. That requires serious medical aid. A slight alteration in the diet and regimen will usually suffice to dispel such as in disposition. So you can change his diet or daily routine. It will immediately give relief to the patient. And to certain that kind of allopathic treatment has been taken to judge how to proceed the cure. Aphorism number 207. Now, when the above information has been gained, you take the case, everything you have now. It still remains for the homeopathic physician to ascertain what kind of allopathic treatment had up to that day been adopted for the chronic disease. You have to find out what type of treatment he is taking while in this chronic disease. What protruding medicine had been chiefly and most frequently employed. Also, what mineral bath had been used and what effect these had produced. This is also our duty as a homeopathic physician. In order to understand some measure of degeneration of the disease from its original state, and while where possible to correct in part these pernicious artificial operations or to enable him to avoid the employment of medicine that have already been improperly used. This is also our duty. Then, intelligent physician who remove the exciting and maintaining cause from the disease picture. Aphorism number 7. So, aphorism number 7, footnote. It is not necessary to say that every intelligent physician would first remove this where it exists, maintaining an exciting cause. He should know that where they are present and how to remove them. The indisposition where thereupon generally sees spontaneously, he will remove from the one room strong smelling flower, which have a tendency to cause syncope, hysterical suffering. So we have to know that what kind of, is it an exciting cause or is it a maintaining cause? Homeopathic physician, especially intelligent homeopathic physician, should know that where this maintaining or exciting cause there and how to remove them. Then he observed the symptoms while vital force asked for help, cure them, thus bringing the vital force back to health. Aphorism number 22, F footnote. The physician should imitate and further the sick nature in its efforts to help itself without considering how irrational it is. To imitate and further these very imperfect, mostly inappropriate efforts of the instinctive, unintelligible vital energy which is implanted in our organism so long as it is healthy to carry on life in harmonious development, but not to heal itself in disease. This is intelligent physician who allow vital force to bring into health, who ask for health. No intelligent physician can try to cure with large dose of drugs and sacrifice the patient's strength. 246. So we cannot give large doses. We cannot repeat that same mistake what other did. So this is homeopathic physician. What Hahnemann wants to tell us, what kind of homeopathic physician should be in practice. So this is all about today's. If you have any question, please ask. Let I will try to give answer of these all things. And next we will discuss health.